Earlier on the Dr. Oz show, viewers shared some of their beauty secrets.
All right, and for today's Oz Plus, some things that should not be kept secret if you are planning on having cosmetic surgery. With us now is Dr. Doris Day. Thanks so much for being with us, Doc.
Thanks for having me.
All right, so give us an idea. What are some of the common mistakes that people make before they're having a cosmetic procedure?
Well, on the one side, they don't ask enough questions of their doctor, and on the other side is they don't take down the information completely. So when you go to the doctor, write down your questions, ask everything, let them know what events you have coming up and when they're coming up. So if you have a procedure that has some downtime, you'll know and they'll know and help you plan for that downtime. Also, maybe it helps to take a friend with you to that consultation, because even if you write down your questions, if you don't write down the answers, you won't remember it later. So a friend will be listening for you and be your advocate in that way.
So it's important to keep notes and make sure you get all that information and follow the instructions, right?
That's another critical one as well. And also tell your doctor everything. If you're taking medications, that doctor needs to know even the over-the-counter medications, because some of them do need to be stopped ahead of time.
Do you think there are a lot of things that people don't realize that they need to avoid, and perhaps they should be asking about that or checking it out before they go into surgery?
Absolutely. One is if you take aspirin or an omega-3 or vitamin E in high doses, it's different than taking a multivitamin. And you're having a procedure that goes through the skin like an injectable or a surgery, you'll have an increased risk of bleeding and bruising, and that bruise can last longer than a typical bruise.
So blood thinners you have to be careful about.
Very
Even
careful.
garlic, for example, sometimes, right?
Absolutely. See, that's a great one to point out as well, because people don't think of that. Not if you eat garlic in your food, but garlic in terms of high doses of garlic or high doses of vitamin E or fish oil.
As we were talking before, how you look is so connected to how you feel mentally. How do you determine whether, what kind of mindset should a person be in when they're going in, making sure that they're not going overboard, that they're just doing something that's going to make them feel a little bit better, but they're not going to regret?
Such a great question. One is make sure you're seeing a qualified aesthetic physician, ideally a dermatologist or plastic surgeon. And we know really when to tell you to stop. I have patients coming in asking for stuff all the time. I don't even say no anymore. I go, absolutely not. When the answer is no, sometimes we really have to put our foot down and say no. So it's okay to ask your doctor, but they should kind of help guide you through treatments. Also, sometimes patients come in and they say, I want something for here, but it's really the cheeks that have fallen. And if you lift the cheeks, it's not always what you see going in. Sometimes a doctor can help guide you as to how to create balance and harmony. And with the new treatments we have, there are so many great ways that we can help complement and enhance your features without changing how you look. So it's a great and exciting time, but you do have to share the information. If you're using a retinol, you want to tell your doctor and maybe stop it before a laser procedure, for example, so that you don't have increased irritation or sensitivity of the skin.
So there are a lot of alternatives, you're saying, and people should look into that, because many times, as you just pointed out, we've done so many different health stories. People become addicted to all of this. They just keep going back for more and more. Why is it? By the way, we like your name, Doris Day.
Thank you.
Isn't that a cool name? You must get teased a lot about that, right?
Thank you. Well, comments.
Good comments, all right?
Good comments.
Absolutely. There are a lot of people who have surgery, and they just look fabulous. They look just terrific. And then there are some people that just do not look good at all. I mean, whether it's Botox or face fillers or whatever, what happens?
Well, sometimes it's where you go. So if you really do need, and I do want to emphasize, seeing a properly trained aesthetic physician like a dermatologist or plastic surgeon, make sure you feel comfortable that you're getting the answers that you need. If you don't feel right about it, just say, I'll come back another time. I want to think about it. Don't feel intimidated that you have to go through. This is not a place to cut corner or price shop. You can prioritize with your doctor, let them know what your biggest concerns are, and you can plan for that. And maybe it's better to do nothing than to do just a little bit of something or do something wrong. And I have patients who I know I say no to, and then they end up going someplace else and somebody else is willing to do it. So there's always someone willing to do it. You have to have a good relationship, and when your doctor says no, no.
That's it.
No one will ever forget her name, Dr. Doris Day.
We like it. Here's to looking
good. Thanks so much. We appreciate
it.
Stay connected with MyFoxNY.com mobile. Download the iPhone app or text Fox5 to 46988 for other devices. Local news, weather, and traffic on the go with MyFoxNY.com mobile.